What is the most effective first step a CNA should take before providing any type of resident care? A. Put on gloves. B. Wash hands with soap and water. C. Wear a face mask. D. Disinfect the room surfaces. Answer, B. Hand hygiene with soap and water is always the first and most effective step to prevent the spread of infection before providing care. A resident is placed on airborne precautions. What additional protection is required beyond standard precautions? A. Surgical mask only. B. N95 respirator. C. Face shield only. D. Double gloves. Answer, B. For airborne diseases like tuberculosis, an N95 respirator is required to filter tiny airborne particles. Which of the following situations requires handwashing with soap and water instead of alcohol-based sanitizer? A. After measuring blood pressure. B. After giving an oral medication. C. After contact with C. difficile stool. D. After putting on clean gloves. Answer, C. C. difficile spores are resistant to alcohol, soap and water must be used. When removing PPE, which items should generally be removed last to prevent contamination? A. Gloves. B. Gown. C. Face shield. D. Mask. Answer, D. The mask is removed last after leaving the patient's room to avoid inhalation of contaminants. A CNA accidentally touches a resident's wound without gloves. What should the CNA do immediately? A. Finish the task quickly. B. Wash hands immediately. C. Put on gloves and continue care. D. Report to the nurse later. Answer, B. Immediate handwashing reduces the risk of transmitting infection to the CNA or others. What is the single most important reason CNAs must follow infection control practices? A. To protect facility reputation. B. To reduce medical costs. C. To prevent healthcare-associated infections. D. To satisfy survey inspectors. Answer, C. Infection control is primarily to protect residents and staff from healthcare-associated infections, HAIs. A resident in isolation asks why staff wear gowns and gloves. What is the best CNA response? A. We don't want to get your illness. B. It is for your protection and ours. C. It is required by the facility policy. D. It helps keep the room clean. Answer, B. Infection control PPE protects both residents and caregivers by limiting transmission. Which of the following is an example of breaking medical asepsis? A. Using gloves when handling body fluids. B. Wiping the stethoscope between residents. C. Placing a clean linen on the floor. D. Washing hands before care. Answer, C. Clean linen placed on the floor is contaminated, breaking medical asepsis. Which residents are at the highest risk of infection? A. Teenagers admitted for surgery. B. Middle-aged adults with no history of illness. C. Elderly residents with chronic conditions. D. Adults in rehabilitation after injury. Answer, C. Elderly residents often have weakened immune systems, making them more vulnerable to infections. A CNA notices a sharps container is almost full. What should the CNA do? A. Push down the sharps to make space. B. Continue to use it until it is overflowing. C. Report and replace it immediately. D. Tape it closed and keep in room. Answer, C. Sharps containers should be replaced when nearly full to prevent accidental needle sticks. When should a CNA wear eye protection? A. During routine feeding. B. When risk of splashing body fluids exists. C. While transporting a resident in a wheelchair. D. During vital signs measurement. Answer, B. Goggles or face shields are worn when there is risk of splashing or spraying fluids. What should a CNA do with a used disposable razor after shaving a resident? A. Place it in the linen hamper. B. Throw it in the trash can. C. Put it in the sharps container. D. Rinse and reuse it. Answer, C. Razors are considered sharps and must be disposed of in a sharps container. A resident with MRSA in a wound requires which type of precautions? A. Airborne. B. Droplet. C. Contact. D. Reverse isolation. Answer, C. MRSA spreads through direct contact, so contact precautions are necessary. Which of the following is the best method to reduce spread of respiratory infections? A. Wearing gloves at all times. B. Covering coughs and sneezes. C. Wearing double masks. D. Avoiding all patient contact. Answer, B. Respiratory hygiene, covering coughs/sneezes, prevents droplet spread. Which statement about hand sanitizers is true? A. They replace hand washing in all situations. B. They are less effective than soap for bacteria. C. They work well unless hands are visibly soiled. D. They kill all microorganisms, including spores. Answer, C. Sanitizers are effective but not when hands are visibly dirty or contaminated with spores. A CNA wears gloves while changing a soiled bed. What should the CNA do immediately after removing gloves? A. Wash hands. B. Apply new gloves right away. C. Clean the bed rails. D. Discard linen bag. Answer, A. Handwashing must always follow glove removal to prevent contamination. What is the correct action if a resident's urine specimen cup leaks during transport? A. Wipe the outside and send it. B. Place in a biohazard bag. C. Pour urine into another cup. D. Discard without reporting. Answer, B. Leaking specimens must be placed in a biohazard bag to prevent contamination. Which is the correct order for donning PPE? A. Gloves, gown, mask. B. Mask, gown, gloves. C. Gown, mask, gloves. D. Mask, gloves, gown. Answer, C. Standard sequence, gown first, then mask, then gloves last. Which action shows proper standard precautions? A. Wearing gloves for all resident contact. B. Washing hands after every resident contact. C. Using sterile gloves for bathing. D. Wearing a mask for feeding. Answer, B. Hand hygiene after every contact is part of standard precautions. Which items should never be shared between residents? A. Towels. B. Wheelchairs. C. Dining room chairs. D. Books. Answer, A. Personal hygiene items like towels are always individual use only. What is the safest way to clean a blood spill on the floor? A. Use plain water only. B. Cover with tissue and discard. C. Clean with bleach solution. D. Mop at end of shift. Answer, C. Blood spills require cleaning with a bleach solution or facility-approved disinfectant. When assisting a resident with a cough and fever, what is the minimum PPE required? A. Gloves only. B. Mask. C. Face shield. D. Gown. Answer, B. A mask protects against droplet transmission from coughs and sneezes. Which action prevents cross-contamination during meal service? A. Handling utensils by the eating ends. B. Serving food with clean tongs. C. Carrying trays under the arm. D. Reusing leftover food from one tray. Answer, B. Using clean utensils prevents contamination of food during service. Which of the following is considered a portal of exit in the chain of infection? A. Healthy skin. B. Broken wound. C. Clean equipment. D. Sterile gloves. Answer, B. A wound provides a path for microorganisms to exit the body. A CNA observes another aide discarding gloves in a regular trash can. What is the correct response? A. Ignore it. B. Report to the charge nurse. C. Pick them out with bare hands. D. Place more trash bags on top. Answer, B. Improper disposal of contaminated PPE should be reported to ensure safety. Which of these requires droplet precautions? A. Tuberculosis. B. Influenza. C. HIV. D. Hepatitis B. Answer, B. Influenza spreads through droplets, requiring masks and droplet precautions. A resident with neutropenia, low white blood cells, is on protective isolation. Which practice is correct? A. CNA wears gown and gloves only. B. Resident wears mask when leaving room. C. Visitors bring fresh flowers. D. CNA avoids handwashing. Answer, B. Protective isolation protects the resident, masks reduce exposure to outside germs. Which practice increases infection risk during catheter care? A. Cleaning from urethra outward. B. Using clean gloves. C. Keeping drainage bag below bladder. D. Tugging catheter during cleaning. Answer, D. Pulling or tugging on catheter disrupts sterility and increases risk of infection. Why should a CNA avoid artificial nails when providing resident care? A. They are not professional in appearance. B. They may puncture gloves. C. They can harbor microorganisms. D. They make handwashing easier. Answer, C. Artificial nails harbor more bacteria, increasing infection risk. Which of the following breaks the chain of infection at the reservoir stage? A. Covering coughs. B. Proper hand hygiene. C. Cleaning and disinfecting equipment. D. Wearing PPE. Answer, C. The reservoir is the environment where pathogens live, cleaning equipment disrupts it. What should a CNA do if exposed to a resident's blood through a cut? A. Wash the area immediately and report. B. Cover with a bandage and ignore. C. Wait until shift ends to report. D. Apply lotion and continue working. Answer, A. Immediate washing and reporting ensures safety and proper exposure protocol. Which of the following is the best example of a fomite? A. Nurse's stethoscope. B. Sneezing resident. C. Mosquito. D. Infected wound. Answer, A. A fomite is a non-living object like a stethoscope that carries pathogens. Which residents are placed on reverse isolation precautions? A. Residents with tuberculosis. B. Residents with influenza. C. Residents with weak immune systems. D. Residents with MRSA. Answer, C. Reverse, protective isolation is for residents vulnerable to infection due to weak immunity. Which is the most important part of handwashing? A. Rinsing under warm water. B. Scrubbing between fingers and under nails. C. Drying hands with towel. D. Turning off faucet with bare hand. Answer, B. Scrubbing removes microbes trapped in hidden areas like nails and between fingers. Which of these would be considered a bloodborne pathogen? A. Hepatitis B. B. Influenza. C. Tuberculosis. D. C. Difficile. Answer, A. Hepatitis B spreads through infected blood, making it a bloodborne pathogen. When a CNA prepares a resident's bed, how can they avoid spreading germs? A. Hold linen close to uniform. B. Shake linen to remove wrinkles. C. Carry linen away from the body. D. Place clean linen on the floor temporarily. Answer, C. Holding linen away prevents contamination from the uniform. What is the minimum time recommended for effective handwashing? A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 40 seconds. Answer, C. At least 20 seconds of scrubbing is required for effective handwashing. A CNA is giving a resident a bath and notices redness under the arm. What is the correct step? A. Apply lotion to prevent infection. B. Wash area harder. C. Report finding to nurse. D. Ignore unless bleeding. Answer, C. Skin changes may indicate infection risk and must be reported. What should be done with meal trays from an isolation room? A. Reuse if food untouched. B. Wash in regular kitchen area. C. Handle with standard precautions. D. Leave in residence room. Answer, C. All trays from isolation rooms must be handled using standard precautions. Which is the most effective way to stop the chain of infection? A. Avoid all resident contact. B. Identify and break one link in the chain. C. Focus only on sterilization. D. Eliminate pathogens entirely. Answer, B. Breaking any single link in the chain of infection stops transmission.